Pneumonic fibrosis. Pulmonary fibrosis is a lung sickness that happens when lung tissue gets harmed and scarred. This thickened, firm tissue makes it harder for your lungs to work appropriately. As aspiratory fibrosis declines, you become logically more winded. The scarring related with aspiratory fibrosis can be brought about by a huge number of components. Be that as it may, as a rule, specialists can't pinpoint what's causing the issue. At the point when a reason can't be discovered, the condition is named idiopathic pulmonary fibrosis. The lung harm brought about by aspiratory fibrosis can't be fixed. However, meds and treatments can now and then assist in ease side effects and improve personal satisfaction. For certain individuals, a lung relocate may be suitable. Pneumonic fibrosis care at Mayo Clinic. Indications. Signs and indications of aspiratory fibrosis may include windedness, dyspnea, a dry hack, exhaustion, unexplained weight reduction, throbbing muscles and joints, extending and adjusting of the tips of the fingers or toes, clubbing. The course of pneumonic fibrosis, and the seriousness of side effects, can shift impressively from one individual to another. A few group become sick rapidly with extreme infection. Others have moderate indications that deteriorate all the more gradually, over months or years. A few group may encounter a quick deteriorating of their side effects, intense compounding, like serious windedness, that may keep going for a few days to weeks. Individuals who have intense intensifications might be put on a mechanical ventilator. Specialists may likewise recommend antimicrobials, corticosteroid meds or different meds to treat an intense intensification. Causes. Pneumonic fibrosis scars and thickens the tissue around and between the air sacs, alveoli, in your lungs. This makes it more hard for oxygen to pass into your circulation system. The harm can be brought about by a wide range of elements, including long-haul openness to specific poisons, certain ailments, radiation treatment and a few drugs. Word-related and natural elements. Long-haul openness to various poisons and contaminations can harm your lungs. These include silica dust, asbestos filaments, hard metal tidies, coal dust, grain dust, bird and creature droppings, radiation therapies. A few group who get radiation treatment for lung or bosom malignant growth give indications of lung harm months or here and there years after the underlying therapy. The seriousness of the harm may rely upon the amount of the lung was presented to radiation, the aggregate sum of radiation managed, regardless of whether chemotherapy likewise was utilized, the presence of hidden lung illness. Meds. Numerous medications can harm your lungs, particularly drugs, for example, chemotherapy drugs. Medications intended to slaughter malignant growth cells, like methotrexate, Trexol, Otrexup, others, and cyclophosphamide, can likewise harm lung tissue. Heart prescriptions. A few medications used to treat unpredictable pulses, like amiodarone, codarone, nexterone, pacerone, may hurt lung tissue. A few antitoxins. Antimicrobials like nitrofurantoin, macrobid, macrodantin, others, or ethambutol can cause lung harm. Mitigating drugs. Certain mitigating medications, for example, rituximab, Rituxan, or sulfasalazine, azulfidine, can cause lung harm. Ailments. Lung harm can likewise result from various conditions, including dermatomyositis, polymyositis, blended connective tissue illness, foundational lupus erythematosus, rheumatoid joint inflammation, sarcoidosis, scleroderma, pneumonia. Numerous substances and conditions can prompt aspiratory fibrosis. All things being equal, by and large, the reason is rarely found. Pneumonic fibrosis with no realized reason is called idiopathic aspiratory fibrosis. Specialists have a few hypotheses about what may trigger idiopathic aspiratory fibrosis, including infections and openness to tobacco smoke. Additionally, a few types of idiopathic pneumonic fibrosis run in families, and heredity may assume a part in idiopathic aspiratory fibrosis. Numerous individuals with idiopathic pneumonic fibrosis may likewise have gastroesophageal reflux infection, GERD, a condition that happens when corrosive from your stomach streams once more into your throat. Continuous examination is assessing if GERD might be a danger factor for idiopathic pneumonic fibrosis, or if GERD may prompt a more quick movement of the condition. Be that as it may, more exploration is expected to decide the relationship between idiopathic respiratory fibrosis and GERD. Hazard factors. Elements that make you more defenseless to pneumonic fibrosis include age. Albeit respiratory fibrosis has been analyzed in kids and newborn children, the problem is significantly more prone to influence moderately aged and more established grown-ups. Sex. Idiopathic pneumonic fibrosis is bound to influence men than ladies. Smoking. Undeniably more smokers and previous smokers foster pneumonic fibrosis than do individuals who have never smoked. Pneumonic fibrosis can happen in patients with emphysema. Certain occupations. You have an expanded danger of creating respiratory fibrosis in the event that you work in mining, cultivating or development, or in case you're presented to poisons known to harm your lungs. Disease medicines. Having radiation therapies to your chest or utilizing certain chemotherapy medications can expand your danger of respiratory fibrosis. Hereditary variables. A few sorts of pneumonic fibrosis run in families, and hereditary variables might be a part. Intricacies. Intricacies of respiratory fibrosis may include hypertension in your lungs, pneumonic hypertension. Dissimilar to foundational hypertension, this condition influences just the supply routes in your lungs. It starts when the littlest supply routes and vessels are packed by scar tissue, making expanded obstruction bloodstream in your lungs. This thusly raises pressure inside the aspiratory conduits and the lower right heart chamber, right ventricle. A few types of aspiratory hypertension are not kidding diseases that become continuously more regrettable and are at times deadly. Right-sided cardiovascular breakdown, cor pulmonale. This genuine condition happens when your heart's lower right chamber, ventricle, needs to siphon more enthusiastically than expected to move blood through somewhat hindered aspiratory veins. Respiratory disappointment. This is frequently the last phase of persistent lung illness. It happens when blood oxygen levels fall hazardously low. Cellular breakdown in the lungs. Long-standing pneumonic fibrosis additionally expands your danger of creating cellular breakdown in the lungs. Lung confusions. As pneumonic fibrosis advances, it might prompt inconveniences, for example, blood clumps in the lungs, a fell lung or lung contaminations.